say enough about the care that Kobe gets at Sutter. And they get that these are not tiny adults, these are kids, and they need a whole different set of rules, and everything's different when it applies to these kids.
We are a children's hospital, a full-service, all subspecialty represented children's hospital within the Sutter Medical Center. We provide the same services that a freestanding children's hospital would provide here, and it passes all the requirements set by the Children's Hospital Association in terms of staffing, ancillary services, and subspecialty services, including the outpatient services.
We have an amazing child life team here with child life specialists who know exactly how to connect with each and every child and family who come here and really partner with them and partner with the nurses and the doctors and the whole medical team to really help each child and family to find the best way for them to get through their experience in the hospital.
The whole floor is really geared for the kids. You can feel it right away. I can't imagine being in the situation we're in with his health and not being at a place like Sutter.
At the Children's Center, we believe in family-centered approach to children's care. We have found that by adopting this family-centered approach, we are a team, and the parents are right there in it with us.
We want to make sure that we're still the primary caretaker, and at Sutter they let you do that. It truly is family-centered care. They work with the families.
We offer a whole range of experience for the children and families here. We want to create as normal of an environment as possible, as comfortable of an environment, so children are able to play and do all the normal childhood activities that they typically do at home.
Sutter Children's Services here at the hospital has greatly improved our ability to help care for our daughter without it being centered around how she's ill, but centered around how life is fun and how we'll get back to where the things were before.
The nurses and the doctors are amazing at really walking us through, teaching us as we go, and making sure that we understand everything that's going on so that we can be ready to go home.
The resources here at Sutter Children's Center are pretty amazing for both the patient as well as for the families to make the hospitalization a little bit easier on everyone. It goes from something as simple as having one of our helper dogs lay in bed with a kid that's recovering to programs for their siblings. We also have just day-to-day resources like a children's playroom and an adolescent teen room that gives the children something to look forward to, activities that our child life specialists provide that really are helpful in the recovery process. And then it goes all the way up to the resources for all of the doctors that are taking care of the patients that all have specialty training in pediatrics. So the breadth of resources is really quite amazing.
It's made it more fun to be here by having the crafts and the distractions. It makes you feel a lot better.
The Children's Center has been at the forefront of technology for more than 2 decades. We started the first neonatal or newborn ECMO program, which is complete support, the heart and lung support for newborns. We are constantly adopting new technologies, and our physicians are on top of most current medical research and adopt it early.
The thing I love the most about the Sutter Children's Center is the collaboration we have among all the different fields of pediatric specialists that help take care of the kids. And that just basically results in great patient care. In addition to state-of-the-art doctors and the team of people that already take care of your kid, we're going to also have a state-of-the-art facility to match that.
The new Anderson Lucchetti Women's and Children's Center is a $800 million enterprise. It will be only one of its kind where the Women and Children's Center are combined. Sutter Children's Center depends on philanthropic dollars for a lot of care that we deliver that is not covered by healthcare dollars. Our Children's Center Child Life program, for instance, is predominantly funded by philanthropic dollars, and if we did not have that, we would lose a very integral part of the care provided here.
For me, one of the most rewarding things is seeing the kids and their parents really work together as a team and support each other through these experiences. You know, we're here to help them, but what's most rewarding is that when they find the strength within themselves to cope with the experiences that they have in the hospital.
And I appreciate the fact that they treat them as children, and health issues or not, all kids need certain things, and patience and caring and feeling safe is are three of the main things that I feel they need in the hospital, and they get that there.